All right, we are packing up, getting ready to go for mom's infusion. This is cycle 2, day 1. There's Erica. Hey! Hi, thanks for clicking on Simply Tanika. I am Tanika. If you are new here, welcome. Hit that subscribe button. Let's hang out a while. If you are returning, welcome back. What's up, fertility fam? We gotta do what? Let's get those babies, ladies. Drops fall and the beauty of it all. Good morning. Oh, it's hump day. Happy hump day to ya. Happy hump day to ya. Happy hump day. Yeah, it is the 18th of March. Today is cycle 2, day 1, and we're prepping for the infusion. So I don't know if you guys know this. There's a chance of getting neuropathy. Let me turn the radio off. When you're doing chemo, which is you could lose the. Hang on. I was listening to WNYC. You could lose some of your nerve sensation in your hands and your feet. And the reason for that is the one medication for the first, well, it's every infusion actually, is Taxol. And your hands and your feet, the circulation is twice as fast as the rest of your body. Because it's, I mean, if you think about it, it's like making a U-turn there. So it's in there twice as long, and the thought is a way to slow that down is to do ice therapy. So we've been doing ice therapy. There's these cute little things you can buy online for your feet, and I'll show you guys later when we get there. But they have basically ice pack at the top and the bottom, and then we have a backup ice bag for each of those, or ice pack. So like halfway through the treatment when it melts, I switch them out so that she's got constant cold therapy going on. We had trouble finding something for the hands because she wants to read while she's there. And so there were like these big giant mitts that didn't make sense. And I got these little ice packs, like they last about 8 hours. And you fold them and she was tucking her hands in there, but her thumb wasn't in there. And I don't know that she was really a fan of it, except this week she started feeling numbness and tingling in her fingers. So we decided to try something different, which is this. So it's just a regular like dishwashing glove, and I'm filling it with ice, and she's gonna lay her hand across the top of it. That way her thumb gets some coolness and her fingers get it. And there will be an ice sensation, so she'll have that slowing down, right? That coolness will slow down that blood flow and hopefully reduce the amount of medicine that's going to her fingertips. So that's it. I thought I would show that because that's a bit of a hack that we came up with. They have these mitts, like I said, you can get online. They're like $36 per mitt, and it's a giant mitt. You can't do anything with your hands while you're sitting there, so you can't read, you can't, whatever, hold an iPad, hold a phone. So that way, she can at least set her hands there, and then when as she's reading, she can lift her hand up and turn the page. Because especially cycle day 1, it's like about 3 hours. It's a long process. The other ones are about 2 hours, but she's getting 2 medications today, Taxol and carboplatinum or platinum. So it's a long process. So yeah, and it's already hard for her, like being so tired because she's used to being active. So I don't want her to be like miserable while she's sitting there. At least keep her mind engaged is good. So that's that. What are you guys up to? What'd you do for St. Patrick's Day? Let me know down below. See you in a bit. Alright, I'm gonna make some French toast and some hot links for mom. And we're officially out of toilet paper. She's gone to napkins. We're still on the hunt. Stop hoarding toilet paper. So the alarm just went off. Mom's got to take her pre-infusion meds and then her regular meds, but she asked for a 10-minute reprieve. So I'm gonna whip up this breakfast and then take that to her, and hopefully she'll be in the mood for her meds. All right, we are packing up, getting ready to go for Mom's infusion. This is cycle 2, day 1. There's Erica. Hey! So I'm just gonna show you what I'm putting in her pack.
Should I buy brown boots?
Let's see. It looks cute.
With these boots?
Yeah, that looks cute. Right, fam? She looks cute. She's good. Okay, so let's get into what we are packing. So those are the ice gloves. She's gonna put her hands like this on them, nice and cold. Elsa is going crazy. Can you hear her? No, you ate off of Mama's hot link. I cut it in half now for her snack.
Oh.
So I cut the part that you bit off.
I'll simply Kendrick.
I made her a sandwich. So I got this little bag. It's insulated for her travel stuff, and there's little mints, anti-nausea. So here are the little booties I was telling you guys about, right? And then it has this foot pack goes on the bottom, and then there's a little toe piece that goes on the top.
For hands?
No, they had mittens.
Like it seemed like it would have little fingers.
We should invent that. I'm serious. They only had mittens, and they sold one mittens for like $35.
Oh, yeah.
But she wanted to be able to turn the page on her book, so she didn't want them.
But if it was like on top and on bottom, like a glove,
Yeah.
pocket.
We should make it.
And then the top and the bottom.
You hear that? We making chemo inventions. So anyway, those are the little booties. And then there's 2 of these because it melts as we're going, obviously. So I switched them like halfway through her Taxol. And then this is what we originally got for her hands. Because like I was saying, she didn't want the mittens because she wanted to do it. But see, she couldn't get her thumb in here. So we're now just going to use this to help keep the gloves cold. So we'll put that on the bottom, put the gloves on, and she'll put her hand on top of the gloves. And that should hold it. Because these are like 8 hours of cool. And so just try to slow down the gloves from melting, because obviously once they melt, it turns into water and it will just come right out of that glove. So yeah, that's it. And then she has half a hot link for her snack, a couple of peaches, some nuts, and some crackers, which I think helps with her nausea. We were packing drinks before, but the hospital was pretty good about getting her drinks, like multiple drinks, orange juice, soda, whatever she wants. So we'll leave that to them. All right, now we're just waiting on the diva to arrive. Oh, speaking of diva, Erica picked this up last week. They have these little volunteer baskets, or baskets that volunteers fill. One of them is a rock. So it says, "Cancer picked the wrong diva." Is that focused? Oh. Hello fam. So we're back home, and for some reason we's tired. We are all tired. Sister's over there laying down playing solitaire. I'm editing for you guys, trying to keep my eyes open. Mom has just emerged from the bedroom, still wanting to cook dinner. So she's gonna do tamale pie, and I'm gonna steam broccoli. So yeah, that's happening. Erica's got to move her car, Mom's car, in a little bit, and then it's 7:44, so Mom's got to take more meds at 8 because she doubled up on me. Anyway, we'll let her slide as long as she's comfortable. So yeah, that is it. I'll show you guys what dinner looks like when that happens. And I am not sure. I have a cough, I'm pretty sure, and I'm suspicious now because when we went to get Mom's blood drawn at the hospital yesterday, before they would let us in, they said, "Do you have a cough?" Did they ask about a fever, or they just asked about a cough?
Yeah, cough fever.
Cough fever. We said no. And then I feel like we went to the storage and my nose was a little sniffly, so last night my throat was hurting. E said hers was too, but she's not been coughing. I coughed once at the hospital and I think twice since I got here. So I'm a big hypochondriac anyway, but I definitely don't want COVID-19. And then Cheyenne told me somebody at her school had it March 11th, so they just sent out a note. They're doing remote learning right now, but last weekend she had a fever and a cough, and the doctor told her to stay in for 48 hours, and then she decided to go out. So I'm a little annoyed about this messaging about the young people are not gonna die from it. I don't think that's the point. If you're a carrier, stay in. And now they're saying that there are young people who are dying, so let's just all try not to get it. Look up influenza. When the flu first came out, people were dying before there was a vaccine. So let's get a vaccine, let's get it under control. And then, I mean, people still die from the flu now. It's just less than what it was. So I imagine COVID-19 will eventually be like that, but we got to get a vaccine. We got to get it under control. So anyway, E, do you think I have COVID-19?
No, ma'am. We
Okay.
ain't got that around here.
No, so we're gonna name it and claim it. No COVID-19 up in this piece. All right. Mom did a little bit of shopping. She wanted the bathroom to be pink. It was brown, which was Erica's dad's favorite color, oddly. Anyway, it's pink. This pink rug, a little Chanel. Love me some Chanel. That pink rug, that pink, that over there, and then a pink, this, whatever that thing is called. I don't have one of those in my house. And then she got herself a little mirror because she said she wanted to be able to see the back of her head, which, okay, whatever makes her happy. And she also got a ring thing, but it has to be installed, like a towel holder. She wants one over here. I think she got a shower caddy. I don't know. Amazon is, we're keeping them in business during this because it's like when Santa comes. It's 2 days, 3 days in a row we've had just stacks of boxes arrive. So anyway, that made her happy. So we're good, and it smells so nice in here. She got the little Glade thingamabob, whatever. It smells lovely. So that's that. All right, dinner is done. The steamed broccoli is ready. Mom just came and got her plate, which she ate pretty good today. I made her French toast this morning. She didn't eat the whole slice, but she ate it. And then she ate hot link, and then she had like a quarter of a hot link sandwich at Chemo. Now she had the tamale pie and broccoli, so yay. She's got us watching sweet potatoes. They're on a timer though, so 38 minutes. She wants those baked. That's it. And tomorrow I'm gonna make sweet potato. She said not sweet potato, tamale, instead of tamale pie, tamale tarts, because I was like, what if we put them in a muffin thing? And I want to practice doing the crust while I have her guidance. I don't make these at home. They remind me of childhood though. Like she always used to make it when I was growing up, but I don't know how to make it, so I'm gonna while I'm here take advantage of the maestro and give it a go tomorrow on my own. But that's it. I'm gonna fix my plate. It's been a long day. It is like almost 11. It's 10:59. I'm tired and wrapping up, but I miss you guys. I'm glad I got to hang out with you. Thanks for hanging out with me, and I'll see you tomorrow. Bye. Baby, that's to us all.